The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
It's man versus microbe, but the antibiotics we use to kill harmful bacteria could be to blame for the mutation of resistant strains. How do we stop the mutating germs from resisting our miracle drugs? As the stomach churns, how can you keep that rumbling in your stomach from bringing your world tumbling down? Living in pain. For millions of people with arthritis, that's the story of their life. How can you cope when it hurts so bad? All this and more today on Today's Health.
You don't have to look into space to find dangerous mutants that threaten us. Unfortunately, the bacteria we encounter every day has an uncanny ability to mutate into stronger drug-resistant strains. Hello, I'm Kathleen Sullivan, and this is Today's Health. Overuse of the antibiotics that we use to destroy germs may actually be the reason that bacteria could eventually kill us. So who is winning the war against bacterial infections? It is a vicious battle between miracle drugs and mutating germs.
Antibiotics, once prescribed as the answer to everything from the common cold to tuberculosis. Now, these miracle drugs may be spawning strains of superbacteria that can resist nearly every known treatment in the pharmacy. But don't blame the drugs for these deadly mutations. It's humans who may be responsible. Overprescription of antibiotics and failure to take the entire prescription has created an environment very conducive to developing resistant bacteria.
The consequence of resistance is that in some instances we've lost the ability to treat certain bacterial infections we were once able to treat.
For example, in one method of bacteria eradication, antibiotics like penicillin and tetracycline invade the bacterial cell walls, which allows water into the germ. That expands the cell and it bursts. If the entire bacterial infection is not wiped out by the antibiotic treatment, the remaining bacteria may become stronger and develop a resistance to the drug. In the theory of evolution, survival of the fittest describes how beneficial traits get passed on and evolve from generation to generation. Unfortunately, bacteria constantly evolve, and the ones that survive an onslaught from antibiotics pass on those traits. Children are possibly the most at risk for passing and receiving resistant strains. Pediatric ear infections top the list for antibiotic prescriptions, and we're finding several strains that don't respond to drugs. Last year, we experienced a serious outbreak of resistant strep A, a flesh-eating germ. An incurable ear infection in a child could cause permanent hearing loss. We have to start using antibiotics more judiciously, or we could neutralize an effective and potent defense.
Antibiotics are essentially inappropriately used by both physicians and patients. Physicians sometimes use the wrong antibiotic. They may prescribe it for the wrong period of time or the wrong dose. Patients, on the other hand, frequently don't take antibiotics as prescribed. They may put the antibiotic in their medicine chest and not take a complete course.
It's important for each one of us to scrutinize our own use of antibiotics, because in the war between drugs and bugs, our own worst enemy may be ourselves.
There's nothing new about resistant bacterial strains. Man and microbe have been locked in the battle since the day penicillin oozed out of a forgotten mold. It took only 5 years for the first resistant strain to develop. So the war will probably never end, but what you and I can do can help prevent us from falling behind.
I first came to use antibiotics with my kids when they would wake up in the middle of the night, they'd have a fever and they'd be crying. When I'd take them in, the doctor would check them, they'd have an ear infection, and he'd prescribe antibiotics for them.
Are you a part of the problem or a part of the solution? The development of bacterial strains that can resist nearly everything in the nation's medicine cabinet could become a national health crisis. But we're not helpless in this situation, and we're not innocent. People who don't take their entire antibiotic prescription are doing more harm than good.
A person will take a drug for a number of days or weeks or months, stop taking it, the disease will recur, and often when it recurs in a drug-resistant form.
Doctors must also share part of the blame. They often prescribe antibiotics for minor infections that would probably heal without them.
I definitely feel that antibiotics are overprescribed. Anytime you go into the doctors, whether there's small inflammation or big inflammation, they don't really give you any idea of what size it is. They just prescribe antibiotics. And I get concerned that it kills off all the bacteria, the good as well as the bad, and then the kids have to build that back up. And by the time they build it back up again, it seems like there's another ear infection.
The financial toll of resistant bacteria could be staggering. If the first antibiotic doesn't work, the patient must try a new prescription. This could add as much as $200 million to the nation's pharmacy bill. Finding the right prescription can be high, but the time lost could be fatal. It's not that the drug to fight them doesn't exist. It's simply that by the time doctors find an antibiotic that works, the infection has already done its damage. The risk of an epidemic from resistant strains is so serious that the CDC keeps a team of epidemiologists on constant alert to go anywhere in the world and face off against a new killer microbe.
This is an important public health issue and one we need to be concerned about, but there are things that we can do about it. We can use antibiotics better. We can try to do things to cut down on the transmission of infectious diseases.
Could our miracle drugs be creating strains of superbacteria? It sounds like the plot from a science fiction novel, but it's not. It's happening today. But by being more careful about the antibiotics you and your children take, you could help prevent a serious situation from becoming a full-blown disaster.
Is that ulcer acting up? Ulcers, indigestion, and other gastrointestinal disorders can make you miserable, but there are things you can do to ease the discomfort of living with ulcers. When we return on Today's Health.
Would you like to see something high-tech? Then just look in the mirror. The human body is by far the most complex system of energy, chemistry, and electronics on this planet. And if we want to live healthier, one important key lies in the better understanding of the dynamics of our interaction.
Pure acid. It can eat a hole right through metal. Pretty powerful stuff. But did you know the acid in your stomach can make what that sulfuric acid did look mild? It's pretty hard to imagine that our bodies can create and contain chemicals that strong. But the complex chemistry of the human digestive tract usually allows these acids to help break down our foods without damaging the rest of our system. Unfortunately, many factors can disturb the precious balance of that chemistry. And when the acids gain the upper hand, an entire gamut of gastrointestinal or GI disorders can follow.
It's a combination of nausea, heartburn, there's reflux involved, and pain, just burning pain.
The stomach produces acid, and the acid plays a role in digestion, but there can be events where there's too much acid secretion. And again, it's a spectrum of disease, from mild heartburn from eating a pepperoni pizza to severe disease with ulcers, bleeding, and severe damage that can occur.
Anti-pain medications called NSAIDs can also inhibit production of prostaglandin, which protects the stomach lining, and that also can lead to ulcers.
People have the misconception that it's the acid per se. What it really is acid being misplaced, and we call that gastroesophageal reflux disease. People know it as heartburn. One is the recently described bacteria, which, as you know, is called H. pylori. The importance is that it's a totally treatable cause of acid. The second cause of ulcers is the drug use of the elderly population and people who have headaches called non-steroidals or aspirin. And they damage the lining of the stomach.
The past 15, 12 years, I had been using a lot of ibuprofen. After an endoscope, they saw that my stomach lining was very perforated or very pitted. The ibuprofen was eating away my stomach lining.
Ulcers and other acid-related gastrointestinal disorders continue to burden millions of people every single day. Hopefully, the treatment and understanding of these problems will continue to progress so that once damaged systems can heal well enough to pass the acid test.
How much do ulcers cost this nation? Between high-tech equipment, medical bills, and lost workdays, those tiny perforations in the stomach have become a major drain on the economy. What are we doing to fight back? Next on Today's Health.
Heartburn, ulcers, and other gastrointestinal disorders can constantly irritate your life. The pain, the discomfort, often make going about your normal routine a very dramatic struggle.
John, I'm not going with you. I can't.
Please, please, please don't tell me there's another.
No, John, it's not that.
Then why? Why? Oh, why can't you just walk out the door with me?
My ulcers, they're acting up again.
Now, I know that may seem a bit overdramatic, but peptic ulcers can be considered a major health problem in this nation. In the best case, they're painful and annoying. In the worst case, they can cause hemorrhaging and even prove fatal.
It's painful, it's disturbing, it's distracting. You feel physically sick, you lose sleep at night.
Heavy pains in my stomach, and when I get these pains, sometimes I have to crawl or lay on my stomach on the floor.
It's difficult to calculate the true cost of ulcers and other gastrointestinal ailments. First, you have the medical costs for hospitalization and treatment, which runs into the billions. Then you have the lost workdays, lower productivity, and lost business. Other than the common cold, gastrointestinal disorders account for the next highest amount of sick days from work. Doctors now have some high-tech tools, like this endoscope, to help them detect and diagnose ulcers.
They put a little tube with a little camera at the end, and they put you to sleep, and they put it down through your mouth, all the way down to reach to the stomach to see where the problem is.
And a flexible tube smaller than my pinky, called an endoscope, is passed through their mouth to look into the swallowing tube and then to look into the stomach. The advantage of the endoscope is obviously it can look all four directions, but it can see what is causing the problem, take a tissue specimen, and if we're looking that there's an ulcer, it can tell us whether H. pylori is present because we can biopsy and actually look for the bacteria.
This stomach has an ulcer. You can see the red, irritated lesion on the stomach lining.
I live a normal life. I'm not even aware of what I eat because I'm on this new medication, and it's been wonderful. It's a combination of, it pre-coats my stomach, so whatever I eat is fine.
I feel better, but the only thing I had to do is change my eating habits. Fish, chicken, vegetables, fruits.
The daily digestive battle between acids and your stomach lining erupts at every meal. Hopefully, new medicines and research will help us better recover when acid scores a victory.
Crippling pain. People with arthritis must cope with it every day, and some pain medications can cause serious problems. How can you stop arthritis from hurting without the risk of harmful side effects? We've got some tips. Stay with us on Today's Health.
You may have heard of a double-edged sword. Well, it's a pretty accurate image for pain. Pain warns us when there's something wrong with our bodies, but unfortunately, it's difficult to quiet it down. Millions of people with arthritis must cope with the torment of pain every day, and how well they manage it can make a big difference in their life.
Before I had arthritis, my perception of it was an old person with gray hair and gnarly looking fingers. I used to do a lot of pottery work, and my arthritis started to hurt me when I'd have to pound the clay and get the air bubbles out.
Over 40 million people in this nation, in all age ranges, suffer from arthritis. Properly managing the pain of arthritis can often mean the difference between getting the most out of life or suffering on the sidelines.
When we talk about arthritis and rheumatism, we're talking about inflammation of joints, and we're talking about pains and other symptoms that may be related to the tissues between the joints, such as muscles, ligaments, tendons, and bones.
And in a joint, what happens is that the joint space becomes diminished. Instead of having a nice joint that has good cartilage, this cartilage now becomes irregular and eroded, and you start getting friction. As an end result, you start getting pain.
Unfortunately, while NSAIDs reduce inflammation and pain, they also reduce production of a chemical called prostaglandin that protects the stomach lining, and that can lead to ulcers. Topical means that the treatment goes directly onto the area that's in pain. The active ingredients in the formula begin to interact with the problem area on contact, unlike oral medications that must be digested and absorbed through the system.
Topical medications, by their nature, are less risky than most of the oral medications. That means a topical medication doesn't cause ulcers. In the stomach, a topical medication doesn't cause addiction.
No matter what you do, arthritis in the hands and fingers can make something as simple as buttoning your shirt a painful ordeal. When arthritis strikes the hip, knees, or other leg joints, walking can be excruciating. It can even cripple.
There's a variety of options now for the patient who has arthritis or pain related to arthritis. They can do very conservative things from local measures such as physical therapy, home exercises. For the patient who needs more than that, they have newer non-steroidal agents. Now they're even over the counter, so the patient has greater access to that.
I don't have time to think about this hurts, so I've just adapted other ways of moving at this point in order to do what I need to get done.
How much pain can you take? At what point do you say, enough, I can't do this anymore? For someone suffering from arthritis, it's an everyday question that must be answered. Hopefully, better methods of pain management will help prevent them from going beyond their threshold.
People have been fighting pain and illness since the dawn of time. Ancient civilizations in India and China discovered plants and minerals that are still commonly used in medicines today. Recently, scientists have taken a new look at some of those old-fashioned remedies to find out if and why they work.
For many years, comments like nonsense or that's ridiculous pretty much summarized the opinions of the medical and scientific communities when asked about some of the holistic remedies passed on for generations. Today, many scientists are taking a new look at some old remedies our great-grandparents learned from their grandparents.
Products that we're using today, natural medicines, have been used for thousands and thousands of years and are still effective today for people.
They used roots, plants, metals, and minerals to cure whatever ailed them. Many of the drugs today come from more sophisticated processes and formulations using the same or similar things. They included 24-karat gold as one of 24 ingredients in Arum's lotion for arthritis pain as a product identifier. They tried several different formulas, and the one with gold was overwhelmingly preferred. Since 1929, physicians have regularly prescribed compounds containing gold for patients suffering from rheumatoid arthritis. But while there's a number of theories, no one really understands how the gold compounds work against the crippling disease. Nobel Prize winner Elias J. Corey postulated that at least one therapeutic compound containing gold could help prevent the oxidation of cell membranes. He also showed that gold could bring excited dioxygen molecules down to a less excited, harmless state.
Western medicine and modern pharmacology is a symptom-suppressive medicine. You give a drug to suppress a symptom. The drugs don't usually cure problems. The difference is that with the folk medicines or the ancient medicines, these medicines, if someone had a cold, rather than the medicine being designed to kill a bacteria, it was used to enhance and build up the immune system so the body could fight these bacteria on its own.
Every day we're finding out more natural, less invasive ways to heal. Some of these methods and techniques date back to the Neolithic age and may have been discarded in modern times as unscientific. We now have the ability to ask the question why, and you never know, we might find some cures from some old home folk remedies.
Arthritis is only a symptom. It's not a cause of a problem, and and you don't have arthritis just because you've reached a certain age. It's an imbalance. Imbalances can be corrected. but they can't be just corrected by having acupuncture or taking an herbal medicine or eating a certain food. It also depends on the patient, what they're willing to do to take an active part in controlling their own health.
Healing stones, metal bracelets, and magic potions may sound like something from the witch doctor's remedy shelf. But today, modern science is reconsidering some of these old cure-alls, like Grandma's chicken soup, to see if there might be some truth to those myths.
Sometimes we don't realize how lucky we are to have our health until we lose it. When we feel well, we think everything's fine, and often we're distracted from doing what's really necessary to stay well. So it's always important to remember a proper diet and regular exercise are key elements for good health. I'm Kathleen Sullivan. Join us again next time as we get right to the heart of the matters that affect your life on Today's Health.
To purchase a complete written transcript or a videotape copy of this or any edition of Today's Health, write to this address or call 1-800-877-7769.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.